In-depth journalism in the Memphis community, the Daily Memphian is of Memphis, not just in Memphis, and seeks to tell the stories of this city. TheDailyMemphian.com. Truth in place.
Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
The potential impact of federal budget cuts on seniors tonight on Behind the Headlines. I'm Eric Barnes with the Daily Memphian. Thanks for joining us. I am joined tonight by two folks working with seniors in the local community. Kim Daugherty is Executive Director for the Aging Commission of the Mid-South. Thanks for being here.
Thank you for having me on the program.
Absolutely. Arnetta Stanton-Macklin is Chief Advocacy and Engagement Officer for MIFA. Thank you for being here.
Thank you.
Along with Bill Dries, reporter with the Daily Memphian. We're talking about, there's so much uncertainty right now with where federal spending is going, whether that's from DOGE or that's the budget negotiations that are coming through. The scope of potential impact, Sally from the Executive Director and CEO of MIFA wrote a column this week about, risks around long-term care, just all the concerns you have. I guess I'll start with you. From MIFA's point of view, your concern about potential changes in federal funding is focused where?
On the Meals on Wheels program. The Meals on Wheels program last fiscal year served over 726,000 meals to over 4,100 seniors. But it was so much more than a meal. The volunteers have that one-on-one contact with seniors that helps prevent isolation and depression and helps them to live in their homes longer. And we're also concerned about our long-term care ombudsman program, where we have advocates that go into long-term care facilities to help advocate for those seniors. A lot of those seniors don't have a voice for them, and those volunteers help to be that voice. From something as small as having issues regarding nutritional based on the food that they're eating to something as major as bed sores and elder abuse.
Yeah. And I pulled this information from Creative Aging. And before I go to Kim, there are 10,000 Americans turn 65 each day, 135,000 adults over 65 in Shelby County. 28% of seniors live alone in Shelby, and 161 projected seniors by 2030 in Shelby County, by the year 2030. So for you all are this point person federally. You're in Shelby County government, but you're designated or created by the federal government, working not just in Shelby County but in some surrounding counties. Your concerns about things you've heard talked about with beyond what we just spoke about with federal budget, federal spending, and cuts.
Sure. We, as you mentioned, the Aging Commission of the Mid-South supports people in Fayette, Lauderdale, Shelby, and Tipton counties. We are an area agency on aging and disability, which was created by the Older Americans Act of 1965 throughout the country. We're one of 9 of these designated organizations across the state of Tennessee. We have a significant relationship with MIFA. We're their largest funding partner, funding nearly 90% of the Meals on Wheels program and nearly 100% of the long-term care advocates or ombudsman there. And so it's a pretty significant relationship. We have heard from a leaked budget or leaked documents of some significant cuts to aging programs. Arnetta mentioned the Ombudsman program. In addition to that, possibly funding that was designated to work through abuse and neglect with older people, as well as help that people receive, call it the SHIP program for Medicare assistance. So there's some of those programs that significant, rumored significant funding cuts to. And so, but I would just say anytime there's rumored cuts to programs funded for people who are older, that's a danger, because truly there's not enough funding to begin with to support all the need for people.
Well, let me also, just for those not close to this, an ombudsman, define ombudsman in layman's terms.
I would just say an advocate
Okay, who goes in and makes sure that there's not abuse there, there's not mismanagement, there's, from abuse to just neglect to accidental neglect. There's a range of things that could go wrong in a senior living facility.
And they actually help support the families. There are family resident councils that the ombudsman help to kind of be that voice. Okay. A lot of times you don't want to say anything to the person that's providing you care or the organization that's providing you care. But the long-term care district ombudsman can be that voice, not only for the elders and seniors themselves, but for the families.
Before I go to Bill, how much funding, I'll go back to you, Kim, how much funding, give or take, are we talking about between, say, Meals on Wheels and in this long-term care advocacy?
Close to $4 million.
So it's a huge amount of money to you all. It is, not to be cavalier, it's not a lot of money in the federal government budget, right? And so, again, before I go to Bill, why do you think this is on the table? What have you heard? It's because, again, it's not going to move the needle particularly on the federal budget. Again, this is just one community, but even if you think about this kind of funding across the whole country, it's not a whole lot. But why this? Or do you have any clarity on why this would be a potential cut?
I think people just don't understand the importance of that advocacy work, and as opposed to advocating, there could be more deaths. If there was not the long-term care ombudsman actually advocating on behalf of the seniors, that could be an increase in mortality rates for seniors.
Yeah. But in Meals on Wheels, do you have any sense of why would the federal government put this in the crosshairs, as people say, of cuts, that food for seniors?
Right. I think, again, it's lack of knowledge. Yeah. And I don't think they really capture the long-term impacts. We provide meals for about $2,500 a year. That's equivalent to 1 day in a hospital or 10 days in a long-term care facility. The prevention is so very, very vital that I just don't think a lot of people recognize the connectivity between the Older Americans Act and the actual services that are being provided.
Let me bring in Bill.
So the advocate sees something wrong in one of the care facilities. Obviously, they bring that to the attention of the folks who are running the place. Do they report it to any agency beyond that?
Yes.
Yeah, I'll just address that. The role of the advocate really is to be that intermediate for the person and or their family who have identified some sort of difficulty. They do try to work that out within the facility, but if they see something that is alarming, that may indeed be abuse and neglect, they are, like all of us, required by law to report that to Adult Protective Services. There are also licensing agencies of the different facilities that the ombudsman report to. There is an ombudsman office at state government level who they are in contact with day in and day out. So there are multiple layers of alerting people to if there should be some horrific situation.
Right. The uncertainty this year, I know just enough to know that this is an annual kind of position that organizations find themselves in. How do you deal with that? Do you try to line up replacement funding for this before it actually happens and hope it doesn't?
Yeah, I'll be honest with you, the magnitude of this is there is no replacement funding for this, right? There is no source with enough funding to replace this level of funding if it were to be cut. There's just not a source of that. There are not private entities or foundations who could replace this level of funding loss. The Older Americans Act across America and the services it provides to people are massive. And so you can't line up a replacement for it. I think back to your question about why this is targeted. I would agree with Ms. Macklin that I'm not sure there is an intent understanding of the importance of this level of these services. For example, these services prevent people from greater uses of Medicare and Medicaid benefits because they keep people healthy. And so once you reduce services such as this, you get into a cycle of people's health declining, which indeed cost more money to assist them, taxes a community greater, taxes the resources in the community greater. And to your point, I don't think people understand the full benefit of the program. And, I had this conversation with some folks yesterday. It's important to remember that we're not talking about numbers. We're talking about impact on people's lives. And when you don't see what we're talking about as people, only as numbers in a budget or dollars, etc., then you don't understand the impact. And so I just encourage everyone to remember, when you talk about dollars, you're talking about people and people's lives.
Arnetta, on MIFA's end, how do you deal with some of the speculation on this? I mean, do you look at curtailing services? Do you look at maybe moving some resources here and there?
Absolutely. We call ourselves right-sizing, if you will. And another thing MIFA's been doing specifically for the Meals on Wheels program is establishing some healthcare partnerships. We have some healthcare partnerships where we're trying to offset the potential cuts, trying to be proactive, not reactive, because we want people to know that there is a direct correlation between food. A lot of people say food is medicine. And so we actually have partnerships with some local hospitals, particularly those target special populations that go into emergency rooms on a regular basis. We're trying to provide the same nutritious meal. And let me be clear, it's a nutritious meal. It's a meal that's cooked with very low sodium and as well as sugar, because a lot of the seniors we serve and target vulnerable populations that we serve have high issues of cancer, diabetes. So it's not just a meal. It's 1/3 of the daily nutrition required for seniors. It's a meat, 2 vegetables, a fruit, and some calcium fortified packets to make sure that it's a great meal that's not only tasty but what's needed to help prevent so many other issues that are related to healthcare in our community. So we're trying to be proactive in terms of healthcare partnerships. We're trying to be innovative in making sure that we serve the senior more than a meal. That social isolation, we have a program called the Claris Tablet, where we're trying to make sure that the senior is connected versus being isolated in the community.
Eric?
About midway through show, and I should note that we're taping this a week ago from when it airs, and the budget negotiations are heavy and underway, so some things could have changed by the time this airs. But you talked about Medicaid, and that is another thing that you all are not administering Medicaid, but maybe I'll go to you on this, Kim. Medicaid cuts are very much on the table of some sort, and they hit not just seniors or people, I guess Medicare kicks in at 65 or beyond, but you've got people on the edge of maybe in their 50s and 60s who are very dependent on Medicaid that could be cut. And that goes into not just hospital and doctors, but long-term care, substance abuse. I mean, those must worry you. You're not, I don't think you're receiving Medicare dollars, but that could have huge impacts on senior and older populations.
We do receive Medicaid
Okay.
dollars.
Okay.
We are a partner with the state of Tennessee and the TennCare Bureau. Should people want long-term care services in Fayette, Lauderdale, Shelby, or Tipton counties, they contact us, and we help prepare their application and forward that on to the TennCare Bureau. So we're very involved in Medicaid services in this area. Anytime we talk about cuts to Medicaid, typically people who participate in Medicaid are the most vulnerable of the vulnerable. They lack financial resources, they lack health care resources, and any destabilization to that system could have an incredible impact on the community. It would impact hospitals, it would impact doctors, and it would certainly impact the people who need those services.
I mean, and it's not to take away from the other issues we're talking about, but we're talking about many, many more thousands of people. I mean, how many people tens of thousands of people across Tennessee, if not 100, who are dependent on Medicaid.
Right.
They're not talking about getting rid of Medicaid, but pretty drastic cuts have been discussed.
There could be cuts.
Yeah,
absolutely.
I see you nodding.
Yeah,
it concerns you as well that these kinds of other second-order effects that even though you're not maybe dependent on Medicaid, but it could hit all the people you work with.
Absolutely.
Yeah, I'm nodding because we actually have over 3,100 people on the waiting list to get on to the program.
Yeah. I didn't actually understand that. Maybe it's having aging parents and parents who passed away, have been in long-term care. And as these cuts came up, that how many people in the country, Tennessee included, that are Medicaid is funding their long-term care?
Oh,
it's massive.
It's massive, yeah. It is a massive amount of people. And again, it is the most vulnerable. It is people who lack the resources to care for themselves. Otherwise, they would not have met the eligibility to participate in the program.
Yeah. Other programs like that, beyond the, and I don't mean to take away from Meals on Wheels and some of the other stuff that you're talking about, but other concerns you have about things that have talked about of cuts that would have either direct impact on things you work with, like the TennCare and Medicaid, or second-order effects on senior populations?
Yeah, for us, I mentioned briefly the proposed cuts to something called the SHIP program, which is the State Health Insurance Program. That's another program we administer at the Aging Commission, and that's where folks can call us at any time, and we help them work through difficulties with Medicare. We help them as they approach the age to sign up for Medicare. During open enrollment, we hold open clinics, and people come into us, and we help them access the information about all the different programs and who to choose. That's a huge program for us where we support more people than any other program. And we hear over and over again from seniors how complex it is to navigate the Medicare system, particularly to choose a Medicare provider, and how important it is to get that service. There's also some discussion of eliminating something called 3D programs that are sponsored by the Older Americans Act, and these are evidence-based interventions that help people prevent falls or teach them how to deal with chronic health care conditions, that sort of thing. That's very vital to communities. And then proposed cuts to the funding given to adult protective services throughout the United States.
Adult protective services is, it's one of those phrases I think I know what it means, but define it if you will.
Yeah, each state has a service where if reported to them that a senior or a vulnerable person is being abused or neglected, they send folks in and kind of investigate that and look to protect that person and sort out their vulnerabilities and get help from them. And so we work closely with Adult Protective Services from the state of Tennessee and in this area when vulnerable seniors are identified that are being abused or neglected, taken advantage of, or people have just gotten to an age where they can't really take care of their own needs anymore, and they're identified to us, and we step in. And so disruptions to that kind of service, along with the disruption to the Ombudsman service, would be very detrimental to communities.
Are there things in MIFA's mission that you look at beyond, you work, most people know MIFA for Meals on Wheels, and we've talked about that, but there are a lot of other programs. Are you worried about direct impacts in federal cuts or just, again, increases in need? I mean, other programs beyond what we've talked about that MIFA has?
Yes, our programs that prevent family homelessness, the HUD funding that impacts, it would be, detrimental to our community. So that's another program.
And the HUD funding helps people. We've done shows on that in the past. It helps people in, interim housing, sometimes domestic violence,
right,
or people who fall in, just economically can't stay where they are. Mm-hmm. So that money runs through you as you're helping people get into other sorts of housing. That's correct.
So both the HUD and the Older Americans Act funding.
And is that on the table? I apologize for not going through all the federal budget negotiations in advance of this.
It's on the table.
It's on the table as a cut as well.
Another program I think that would be particularly concerning in our community is the LAHI program. You all may have heard of that.
I have not.
It's low income assistance for energy, and it really helps a lot of people with their light bills during time periods when maybe light bills are higher for air conditioning or heat or what have you. And we see that as a program that's very supportive of seniors in our community. That's a program that has been mentioned for some cuts, and it would be incredibly detrimental in our community.
Are there opportunities or communication here with other governments, Shelby County government in particular, about maybe stepping in to fill some of these gaps if they happen?
So we've spoken. We had a huge campaign called March for Meals. people have to understand that Meals on Wheels is not based on one's income. It's food insecurity, senior food insecurity is based on one's access to food. So we have a lot of the suburban mayors this year came to deliver meals in their area. So a lot of them have given us support from a volunteer perspective, and yes, we will be asking them to support us financially as well.
Right, but because that, I take it, that lack of access has to do with food deserts in those areas?
Right.
Is that correct?
That, as well as you may have access, but if you're still staying by yourself, you're still considered food insecure if you can't prepare the food, the healthy food for yourself, even if you have a grocery store up the street.
Right. The other thing that this kind of brings into perspective, I think, is the state of what people call the safety net here. That's kind of a changing thing from time to time, isn't it?
Right. It really is. And primarily what we are talking about are safety net services. We're not talking about extravagant services in any way. We're talking about meeting the needs of people who have some reason in their life that they're really unable to care for themselves any longer or meet a basic need of their life, be that economical or physical or maybe a mental condition, be it Alzheimer's, dementia, or something like that. People are just no longer able to meet their own basic needs, and that's where our services step in.
You mentioned county government. I'll go to Bill and ask a question. We're in the middle of city budget time. Again, we're a week delayed. It's not like there's a lot of room in the city budget, right, to fill in. I mean, they're talking about trying to barely hang on to a steady state budget. They're talking about, not funding MATA to the degree a lot of people would like. The local governments are not flush with cash right now.
No.
Or tell me otherwise.
No, they're not, because this is also the first budget season after some of the pandemic funding ran out. The American Rescue Plan Act, the CARES funding, which I think was the first money in, went quite a while back.
Yeah, and county government is trying to build a school, if not two big schools. It's got all kinds of
Regional One Health,
all these sorts of things. Yeah. So it's
more to come on that,
and more to come on that. Yeah. With just a few minutes left here, I'm sorry, I lost my voice. What else are we missing? What else do you? Let me go to you. Other programs that MIFA offers that again people maybe unintentionally forget about.
Right. Like I said, our programs that prevent family homelessness. We have a rapid rehousing program, a homeless hotline. We provide rent, utility, and mortgage assistance for persons who've experienced an emergency situation. And so those programs, I think people just take for granted that if these HUD funding and these Older American Act funds are cut, they could have detrimental impact on our already impoverished community.
And about how many families in the homeless space, give or take, about how many families or individuals are you touching every year?
So I'm glad I brought my little notes here.
Yeah, it's not meant to be a homework assignment. I apologize.
No, that's okay.
But it's important to get the scale. I think, as Kim said, we're talking about humans, not just dollars, and
Absolutely.
not just government programs.
Absolutely. Last fiscal year, we served over 11,000 households, including 12,618 adults and over 9,000 children. Yeah. And again, as Kim says, not just the numbers. We have stories that people are telling us, and the faces of these recipients are changing. It's not just your typical person who has been unemployed. These are people who have been employed, but due to cuts from jobs and things of that nature, they're experiencing these needs for MIFA services for the first time.
One more pop quiz question for you. Is your overall budget at MIFA, all spending every year, is give or take what?
About $10 to $12 million.
Yeah. Other things that we didn't get to, because you guys do have this huge, and let me ask this too. How does this play? We're very Memphis-centric in the show, but the coverage area of KNO extends into rural areas or, outside of Shelby County. Sure. Are the dynamics different in the smaller or less populated counties in the sense of there are maybe more services in Shelby County, there are maybe more stopgaps, there are foundations, they may not fill all the gaps. When you talk about Lauderdale, you talk about Fayette, you're talking about pretty poor places. Yeah,
Lauderdale is recognized as one of the most poor counties in the state of Tennessee. I mean, Lauderdale County is really an impoverished county. The other counties have their difficulties. I would say that to a senior, it doesn't matter where you live. If you're hungry,
Yeah.
It doesn't matter where you live. If you need care in your home, those things don't matter where you live. And so we are very sensitive to meeting the needs of each senior where they're at. There can be the appearance of more resources in a larger place or in an urban environment, but there are also more stressors on and need for those places for services. And so, we really feel that each senior, no matter where they live, needs access to these services.
Kim, we don't know, as we're airing this 1 week after we recorded it, there's lots of negotiations going on at the federal level, and we're really talking about federal money. The programs and the risks that you are most concerned about right now?
The programs we're most concerned about right now are the SHIP program that assists people with Medicare benefits, the Ombudsman program that they house for us over at MIFA.
That does advocacy and long-term care facilities, neglect, abuse, all those kinds of things.
That's correct. Evidence-based health interventions that are provided to seniors throughout the community to help them learn how to care for chronic health care conditions, be safer from falls, that sort of thing. And then monies that are directed toward the states to help them deal with abuse and neglect issues. Those are the programs that we are most concerned about at this time.
And ballpark, how much money are we talking about?
On the federal level, of course, it's millions of dollars. In our community, it would be probably several $100,000 when you take into account all the different programs and the way those programs impact our community.
But even and we'll bring in Arnetta Stanton-Macklin from MIFA here in a second. I mean, the MIFA gets from you all, 90% of Meals on Wheels is funded by the Aging Commission, and a lot of that is this federal money coming down.
Correct.
And that's at risk, is a program that lots of people know.
It's a program that lots of people know. We haven't heard specific details about targeting that program, but in an environment where we do hear that funding for programs for seniors can be targeted, we want to be prepared, consider, be thoughtful about all of that. Yes.
Again, Arnetta, I'm bringing you in, your Chief Advocacy and Engagement Officer for MIFA. Your concerns right now, and again, it's a lot of rumors. It's not clear. I mean, you're sort of dealing with this, and there are a lot of other, I should note, that other organizations and people working with other groups who are really concerned right now, and we'll try to get to those over the course of the summer in terms of potential cuts or actual cuts to funding that flows down to the local community. But again, from a MIFA point of view, it's not just Meals on Wheels that you're concerned about. There are other programs that MIFA does that are potentially at risk. Right.
Our programs that help prevent family homelessness through the Housing and Urban Development.
And for people who aren't familiar, their emergency housing, maybe there's a domestic violence situation, it's an economic situation. How do those programs work?
So we have a family shelter placement program in which we place persons who are needed in family shelters, as well as a rapid rehousing program where we connect families with permanent, stable housing, as well as a homeless hotline program.
Another one, Kim, and we'll talk much more about this tonight at 7 on WKNO on Channel 10, or you can get the video online at WKNO.org or the Daily Memphian. But we'll talk about Medicaid cuts are very much on the table and have been talked about. A huge amount of spending, a huge, in Tennessee and the Memphis area. You also serve the counties around here. What would cuts to Medicaid do to senior populations?
We have lots of seniors who are very vulnerable economically and with health care conditions that are dependent on Medicaid services. Typically, people who participate in Medicaid services are the most vulnerable of the vulnerable. Economically, you have to have less than $2,000 in total assets to qualify for the program. And so people have their physical condition is deteriorated pretty much, and they lack any sort of resources to care for themselves. And so the Medicaid program is very important to long-term care for seniors who really lack resources in our community. It's vital.
I'm guilty of not understanding that until the conversations about potential cuts. And I, on national news, heard that I had assumed Medicaid went up until you got on Medicare, and then people are on Medicare. But Medicaid extends, especially in terms of nursing homes and long-term care and assisted, all those kinds of things. It's a huge supplier of funds to seniors who and it's an aging population. I mean, there's a boom of people who are going to need long-term care. Medicaid is not just for the poor, right? It's not just for the non-Medicare poor, and that's a misconception I think I had, and I think many other people had. But long-term care is incredibly important, and the need is only growing.
Yeah, long-term care is incredibly important, and I do think it's important for people to recognize that Medicaid itself, it is really designated for people who lack any sort of resources to care for themselves. You can't get Medicaid unless you're financially very limited and that your physical health is deteriorated to a pretty poor condition.
Yep. We're out of time. Thank you both for what you do. Thank you for being here and talking about this. Thank you, Bill. I will mention a couple things here, including actually talking about Bill's extensive series on Tom Lee and the 100-year anniversary. It's in the Daily Memphian. It's many, many stories. There's also a documentary that aired on WKNO last week, Shine On, about the history of Tom Lee. You can get that at WKNO.org if you missed it. We recently also had shows with D.A. Mulroy, with Josh Spickler from Just City, Bill Gibbons, the former DA, now with the Memphis Shelby County Crime Commission. So you can get all those at WKNO.org. You can get them at the Daily Memphian or YouTube, or you can download all the shows as podcasts wherever you get your podcasts. Thanks very much, and we'll see you next week.